And now I'm happy to hand over the floor to our rapporteur, Mr. Busoi.
President, thank you for your proposal. I had the same idea to take the two items together because they go on the same lines. The two proposals we are discussing today are extremely important for the future of research and innovation. We have repeated here and in other committees that EU needed more innovation, that the lack of innovation was a great handicap for EU in terms of competitiveness. From my point of view, we have to find the best way to support excellent science and to bridge the gap between research and innovation, which will support our industrial leadership and respond to societal challenges. Simplification of procedures in order to encourage the broadest participation in research and innovation activities of various stakeholders, such as SMEs, academia, the civil society, and so on, is also very necessary. First of all, I would like to thank the European Commission for their hard work on these proposals. The proposals are very comprehensive, and I believe they go in the right direction. The amendments I have proposed are mainly additions meant to put more focus on one aspect or another, but they do not change the underlying structure of the programme proposed by the Commission. I want to stress from the beginning that the proposals I have made are mainly focused on healthcare research, but they also deal with other aspects of great importance for ENVI, even to a smaller extent. I will table amendments myself on those issues which I haven't enough time to consider properly, and I am also open to any proposals the shadows or other colleagues from this committee may have. Concerning the healthcare research, the objective should be indeed to improve lifelong health and well-being for all, and here I think a shift in focus from treatment to prevention is crucial for sustainability of our healthcare systems. This is why I strongly believe that we should firmly support research to better understand health determinants and diseases, which will ultimately help us to develop both better preventive tools, including innovative vaccines, and also better treatments. I very much welcome the emphasis the Commission has put on research in the area of chronic diseases, which currently place a significant burden on our healthcare systems. This will only become worse in future due to aging population, hence the added value of prevention. The Commission has included a series of examples of chronic diseases: cancer, cardiovascular diseases, diabetes, and so on. This is considerable pressure to include other diseases in the proposal. Instead of adding new diseases, I would like to clarify that these are just examples which do not preclude the priorities in terms of funding that the Commission will establish in the work programmes. Otherwise, we'll end up with a very long list, and the list will most probably still not be exhaustive, so I think it's better to keep some flexibility here. An aspect that needs stronger emphasis from my point of view is the area of rare diseases and the development of orphan drugs. Despite their rarity, those diseases affect nearly 30 million Europeans who do not have proper access to treatment simply because in some areas therapies may not exist. This is an area where the European Union could bring significant added value precisely by encouraging better sharing of the scarce knowledge in this area. Support for biomedical research is also crucial from my point of view in order to develop stratified and personalized medicine which is tailored to an individual patient's genetic makeup and to his disease type. This is also something which would allow us to save money by not spending any more on inefficient therapies. Moreover, concerning the infectious diseases, I think we should not forget about poverty-related and neglected diseases, and that we should continue to support international collaboration in this area. I have also proposed in the draft opinion on the implementation of Horizon 2020 to have a separate priority on environmental health within the health section. Irrespective of the area we are talking about, it is important to create a link between science and clinical research to make sure that the results of fundamental research are translated into innovative products in a timely manner, if possible, to the benefit of the society as a whole. This is why I strongly believe that Horizon 2020 should firmly support translational research. Interdisciplinarity is another key point that I would like to stress. This is mainly because many chronic diseases have similar mechanisms, and crosstalk between the various disciplines of medicine could increase the quality and efficiency of research and get better outcomes for patients. I would like to finish on healthcare with a few remarks on stem cells, which have been for a long time a controversial part of research and innovation policy. I am fully aware of the problems raised in terms of bioethics by embryonic stem cells, and that the national legislation on this are quite diverse. However, I think that clarification is needed on this issue. Stem cell therapies have enormous benefits for patients, for example in the field of regenerative medicine or as a treatment for other life-threatening diseases. This is why I believe that it is necessary to send a positive message, at least concerning adult stem cells, or alternatives to embryonic stem cells, such as the ones coming from the cord blood or induced pluripotent stem cells, even if their equivalence to embryonic stem cells still need to be scientifically proven. But this is the kind of research that could be supported. Concerning the food security part of the program, I have proposed a change in the title to clarify that food safety issues are covered, which is in line with the content of the section. The other amendments put a special emphasis on research aiming at improving diets, including research supporting the reformulation of the recipes, which would contribute also to the health objectives. On the energy part, the amendments I have proposed in the two draft opinions put emphasis on the need for research in order to obtain more efficient and renewable heating and cooling systems and to develop innovative solutions for the storage of energy for renewable sources. I also propose that resource efficiency should be considered as a cross-cutting challenge which should be pursued throughout the Horizon 2020 program. Turning now to a couple of implementational issues, I think it's important that we have set a solid performance indicators to assess the results of Horizon 2020 and the extent to which the actions financed respond to the set priorities. I have proposed a few extra indicators which I see as more meaningful and relevant as compared to the objectives of the program. These include the number of SMEs receiving financing, the number of jobs created, the number of inventions commercialized, and ultimately the contribution to GDP growth. Coordination of research is also a very important issue where I propose some amendment and I might table some additional ones. I strongly believe that there is a need for strategic coordination between research activities funded at union and national level to avoid any wasteful duplication in funding. The financing at EU level should basically be targeted towards projects which present a real added value and are complementary to national research programs. I would like to finish now by addressing the budget, which is one of the most important issues. As you may have seen, I have not tabled any amendment on the figures proposed by the Commission, apart from the one asking for 12% allocation for healthcare research, as it was the case for FP7, and the second one asking for a more substantial support for innovative SMEs. My proposal would be to remove the figures and replace them by percentages of the total allocation for the program. This option has been chosen in the lead committee, ITRE committee, and it has the advantage of keeping the respective weight of the funded areas in case the final envelope changes during the discussions on the MFF within the Council. This is why I will propose a comprehensive amendment on the budget very soon. I think in any case we need to stay reasonable in our demands if we really want to get something in the end. Leaving the breakdown of the budget aside, as a general remark, I would say that the budget proposed is good, even that it could have been more ambitious given the needs in terms of financing of research and of innovation at